Right now, Florida is reporting more than 89,000 total cases of the coronavirus. 175 more cases were reported in Duval County alone on Friday. Joining us now with more is Dr. Matthew Thompson from Telescope Health. Doctor, thank you so much for being with us this morning.
Yeah, it's my pleasure.
When we take a look at these numbers, first and foremost, what do these numbers tell us right now?
Well, it definitely indicates that we're seeing just another spike, which is likely due to people wanting to get back to some form of normalcy and maybe lapsing a little bit on some of the precautions that have been recommended by CDC.
And with that being said, and seeing the spike in numbers, how important is it for people not to become complacent?
Yeah, it's extremely important. And what we're seeing is obviously people who are going back out to restaurants, going back out to bars, just going about your daily life, going to the grocery store. I live in Jax Beach, for example, and when I'm out, I see very few people wearing masks and practicing that social distancing and 6 feet distance from each other. So I think what's important is that we continue those efforts. Maybe those who are younger, who don't have pre-existing conditions or heart or lung conditions, maybe they're not as worried about this, but it's just 1 degree of separation from someone maybe who does have those conditions who could be hit really hard from this. And even we are seeing young people who still are having a really hard time with this infection and requiring prolonged stays in ICU and a lot of other complications.
And we're seeing this spike just weeks after we entered into phase 2 and after we saw some of those protests in our area where some people did wear masks and practice social distancing, but we also did see some peaceful protests where people weren't wearing masks and really not staying far apart from each other. What role could those 2 events have played in the numbers that we're now seeing?
Yeah, certainly there's a lot of factors that have led to an increase in cases. I will say this, if you're going to protest, please wear a mask. The nice thing that we've seen with the data on protests so far is that there wasn't necessarily as drastic of a spike in cases due directly to the protests as we thought. There was an increase in some cities, but because it's outside, because you're not in an enclosed environment, and a lot of people are wearing masks, that's certainly beneficial. I would say that anytime you're around a group of people, wear a mask, be cognizant of your surroundings, wash your hands, practice good hygiene. But it's really the indoor areas that are even more concerning. If you think about it, if you're in an enclosed space in a bar or restaurant, those particles are just circulating around without any ability to have free air movement. So it's really getting back to the restaurants and things that we all want to do. We want to be out and enjoy our food and our friends, but we really, everywhere we go, we should be aware of the possibility of spreading the virus.
And in your medical opinion, what should we expect going forward now that we are starting to see those numbers rise a little bit?
Well, I think that we're going to continue to see a spike, and as opposed to last time, I know that people are resistant to really returning to a full quarantine mode. I think that in the ER, I'm already seeing. I worked a shift 2 days ago at Baptist Beaches, and I'm already seeing more cases, people coming in, and what we want to try to avoid is those who could really be potentially hit the hardest from this, those who are elderly, who have underlying conditions, and we want to reduce that burden on the healthcare system and keep people safe. So I would say that as we move forward, if we can continue to just make this a reminder to stay vigilant and practice our social awareness around others, wear a mask, then we can prevent an even bigger spike.
And I do also want to ask you, as we see people who test positive, how important is it for those who have come in contact with those people who have now tested positive to make sure they're self-isolating and also making sure they are taking those measures that you talked about, like wearing a mask?
Yeah, it's extremely important. The incubation period for COVID-19, meaning the time that the virus is in you, but you don't know that you're infected, is up to 14 days. And so if you've been exposed, don't go by the fact that you don't have symptoms yet and say, I'm okay. Really, we should all be practicing, the pattern of saying, I have the potential to be infected. I should seek testing. There are a number of testing sites that are open now, Lot J being the largest, where you can go get tested. But I would say, assume that you have been exposed and protect those who are around you. There are a lot of asymptomatic carriers as well. that could have the virus as well. So,
Dr. Matthew Thompson, thank you so much for being with us this morning.
yeah, it's my pleasure. Thank you.